Hello, my name is Rose Tran. I will be presenting a video of the nursing issue paper. So number one, discuss the impact of this issue has on society. So presently, the United States in the midst of the major unprecedented public health opiate epidemic that transfers race, gender, age, and health status and socioeconomic level. The opioid epidemic, now a crisis in America, reflects the deadliest in history, where predictions of the death toll will continue to escalate in the years to come. Despite billions of dollars allocated to address the opioid epidemic, the crisis has worsened with more deadly outcomes. More opioid-related death occurs per year than mortality from recent wars, motor vehicle accident, gun violence, and HIV. According to the National Institute of the Drug Abuse, in 2016, the national death rate from opioid overdose was 21.7 deaths per 100,000, reflecting a dramatic increase since 2013, when the United States rate was 7.6 deaths per 100,000. The opioid crisis in America has created a tremendous economic burden. According to the Council of the Economic Advisories, in 2015, the economic cost of the opioids crisis was $504 billion, or 2.8% of the gross domestic product. Later in 2018, the estimated cost in the United States economic from opioid epidemic rose to $631 billion, which critically component of the financial burden, and estimates of the percentage of Pacific exhibitors are as follows. The healthcare was 33%, premature death was 40%, criminal justice was 60%, and child and family assistance and education program were 6%, and lost productivity was 15%. The lost productivity, such as work impairments, involves not only the abuser but also with the family members, of close friends, and associates. Additionally, the opioid epidemic has fueled excessive financial burden to the nation, including federal, state, local governments, and healthcare private plans, and society at large. Between the year of 2001 and 2017, the U.S. healthcare exhibitors topped it at $215.7 billion, and federal costs accounted for 14% of the financial burden related to the epidemic. The nursing economic article I have chosen has the most recent statistic data, and that it shows the declining of situation what's going on with the opioid epidemic, and it does explains pretty good with all the recent facts is happening in the United States, which address what's going on. And the thing I liked about the article is that it helps to like understand what's happening in the with the opioid epidemic, and it has some of the approach for the care of like having the nurse to call action, and it tells about how to like combat these crises happening of from this article that I have read about it. So number two is explain your purpose in the writing paper. Is that the purpose of the writing paper is to improve the nurse's knowledge to opioid misuse and negative attitudes toward patients with opioid use disorder. The need to educate nurses in practice and academically to treat individuals with opioid use disorders with intervention based on best evidence and well documented. The American Society of the Addiction Medicines has advocated for change in perspective in how society of healthcare providers view individuals with opioid use disorders and transitions from the negative perceptions of the moral weakness to treatable chronic of neurophysiology disease. The need to decrease the stigma and use best scientific evidence to treat patients with opioid use disorder in the most humanistic uh, humanistic approach to confront the disease through the change of perspective, education, focusing on treating opioid use disorders as a disease will automatically result in lessening the stigma, more positive and nurses of attitudes, and improved recovery rates. So number three is discuss what you found in the literature related to the topic. So the literature that was related to my topic would be that is nurses pain management of the knowledge, attitudes, and the practice. Because before the intervention, the nurses' knowledge have less of significant of learning about the pharmacological and the pain assessments, that they didn't really have a really good proper training, especially coming from nursing school and everything. And the other thing was because of the increase of the nurses' score of pain relating of the management, they consistently have not changed their ways of practice that needs to be addressed. So the information has directed the intervention that needs to be addressed to the nurses is to be required a standardized assessment tool and assess the patient pain recommended by the protocol of what is going to be used for the intervention that I would use for the topic, which is going to be in number 4. So the study was conducted by the Ethical Review Board of the hospital, where the Department of the Nursing issued the pain management nursing protocol for medical and surgical patients in both paper and electronic formats. The protocol focused on the general aspects of the comprehensive pain assessment and intervention of pain. The protocol focused on the general aspects through the implementing of the protocol for the patients and a hard copy of acute pain management handbook for nurses to prepare by the nurse manager, and it would be available for nurses stations as a reference. What it includes is the pain assessments, basic pain physiology, pharmacological and non-pharmacological strategies of pain and document of the pain management. The nurses were required to read the protocol and the handbook and to attend 1 or 2 hours of sessions provided by the director of nursing. The finding of the study demonstrated that introducing pain management protocol was associated with improvements in some features of nurses' knowledge and attitudes with some treatment process that changes. So the staff implemented not only the pain management protocol, but the intervention of the non-pharmacological methods that used most commonly by patients. The statistics data show after intervention use was COPAC of 59%, talking to someone about 53%, and distractions 49%, and the relaxation is 18%, and the others are like 3%. So clinical significant improvements were observed in patient assessments relate to intensity of pain. Non-pharmacological treatment also increased significantly, especially nurse providing COPACs. The decrease in pain rating related to the patients received combined with the pain management protocol and non-pharmacological intervention decreased the pain reported by the patients. So it was really successful through it, and it's helped a lot for the patient's pain and reduced the use of opiates. Thank you.